Hey everyone, I'm Kat. Today we're going to be talking about depression. It is just going to be a bit of a more general overview of depression, and later on we'll have a more scientific video about it, going into what goes on in the brain during depression and things like that. But today we're going to keep it pretty simple again today. Depression is a very common mental illness, and it actually affects about 1 in 10 people. Anyone could get depression, and it is completely treatable. Depression is a long-lasting mood disorder, and it can affect several things from your day-to-day life to finding pleasure in activities. It can affect your ability to do everyday tasks, to enjoy things, to find pleasure in activities. It can also interfere with your daily work and even your relationships. Depression can also influence some chronic disorders such as arthritis, asthma, cardiovascular disease, cancer, and even diabetes. Depression can make everything in your day-to-day life feel a lot less worthwhile and even make it harder to do. But at its very worst, depression can make you feel suicidal. There are 9 different types of depression that I'm going to mention and just kind of explain to you what the terms mean. So first is clinical depression. This is a very common term, but it really just means that a doctor has diagnosed you with depression. It is not an actual diagnosis in itself. A depressive episode is the formal name that a doctor gives to depression when they make the diagnosis. And recurrent depressive disorder is when you have repeated episodes of depression. These episodes may individually differ in severity, meaning that they could only moderately affect you or severely impact your life. Reactive depression, that was a bird. I just got distracted by a bird. Reactive depression describes a type of depression that is caused by stressful events in your life. This can be separated from an adjustment disorder, where you may struggle with symptoms of depression due to a major life change. You can also suffer from a severe depressive episode with psychotic symptoms. I think when you use the word psychotic, people tend to panic a little more than they need to. This means that severe depression can lead to hallucinations and delusions, which are symptoms of psychosis. Hallucinations are hearing, smelling, tasting, feeling or hearing things that aren't real. And delusions are believing things that don't line up with reality. You may have heard of delusions of grandeur or persecutory delusions. Dysthymia, if I'm pronouncing that right, describes a situation where the symptoms of the symptoms of depression persist for many years, but they are not severe enough and don't last long enough to be diagnosed as recurrent depressive disorder. Another type of depression is called cyclothymia. You may be diagnosed with this if you experience persistently unstable moods. You may have several periods of depression and several periods of elation or extreme happiness. These periods will not last long enough or be severe enough for you to be diagnosed with recurrent depressive disorder or bipolar disorder. Seasonal affective disorder affects people at a specific time of the year, usually in the winter. People with SAD, they may find that they feel more sleepy or they crave carbs like chocolate, bread, cake, although who doesn't crave those all the time? So this is what makes the January blues. It's seasonal affective disorder. You may find that the long dark periods just make you feel a little bit down, a little bit worse, and that may be seasonal affective disorder. So the last two are prenatal depression, which occurs during pregnancy, and postnatal depression, which occurs in the year following childbirth. A term that you've probably heard a lot is manic depression, and this isn't actually a diagnosis anymore, because it is the old name for bipolar disorder. This is different from depression, and it will be in a different video in the future, hopefully. The symptoms of depression are more than simply feeling a bit sad, a bit down. Everybody feels a bit sad and down sometimes. Life just ends up like that. But if you Google the symptoms of depression, you will find that there's so many more than that. And I'm going to just list a couple here now. Actually, it's quite a lot, so strap in. Somebody with depression may feel low, sad, irritable, angry, restless, agitated, guilty, worthless, empty, numb, hopeless, or despairing. Which is a lovely list of words there, just to totally cheer you up. They may also feel isolated or unable to relate to other people. This may lead to them pulling back from social activities that they may be used to enjoy, or not wanting to hang out with your friends or anything like that. It can also translate into reduced enjoyment of your favorite activities and also sexual engagement as well. You may feel fatigued, have headaches, digestive issues. You may sleep too much or too little, and engage in high-risk activity like using drugs or drinking too much, or anything else that may be deemed a little bit too dangerous. Someone with depression may struggle to concentrate over a long period of time, and they may have difficulty completing tasks. You also may notice a change in weight with someone who has depression, and also changes in their appetite. And at the worst end of depression is the thoughts of self-harm and suicide, which is very important to look out for in someone with depression. These symptoms may affect men and women differently as well. So, and not everyone will show the same symptoms of depression. There are many causes of depression, and there may not be a single cause. It may be a few different things interacting with each other that can cause you to have depression. Today I'm going to just quickly talk about 5 of those causes. The first is genetic factors. You are more likely to develop depression if there is a history of depression in your family. It's unclear if there is a specific gene for this, or if maybe it's something more social, like learning coping mechanisms from parents, aunts, uncles, grandparents who have had depression. The second cause is life events. Depression can be triggered by an unwelcome, stressful, or traumatic event such as unemployment, bereavement, the end of a relationship, or abuse or assault. These can include chronic or life-threatening disorders, or a physical health problem that significantly impacts your lifestyle. For example, somebody may have severely impaired mobility and they can't leave their house without assistance, and this could just lead them to a downward spiral of depression. The fourth cause is medication, drugs, and alcohol. Some medications may have depression as a side effect, and this may be something that you want to discuss with your doctor if you're about to go on to any new medication. I know we've been on and off a few that can cause severe depression for about 2 weeks, and then it sort of teeters off, which we're thankful for. But also the use of recreational drugs, illegal ones, and alcohol, while they may originally make you feel good, or initially make you feel good, you will probably feel worse afterwards, and they can lead you to feeling depression. They may put you at greater risk of developing depression in the future. And finally, we have other mental health problems. It is common for depression to accompany other mental health problems because dealing with the symptoms of these can trigger depression. These may include PTSD, anxiety, or eating disorders. As I mentioned at the start of the video, depression is entirely treatable. It cannot be cured, but it can be treated. The difference between curing and treating is curing is getting rid of it. So if you cure cancer, eliminating cancer. Treating it just helps you alleviate the symptoms and be able to cope with it on the daily basis to get through your life. So there are a couple of different treatments. The first one is talking therapies. The type of therapy that you're offered will probably differ depending on the severity of your depression, the type of depression. And these include cognitive behavioral therapy and counselling as well. They could be group sessions or one-on-one, and I know a lot of people are they maybe feel a little bit of an aversion towards these types of therapy, but they are really very good at helping you find the root cause of your depression and being able to cope and deal with it, and maybe even teaching you coping skills for the future. And of course, there is medication, different antidepressants that may be offered to you if the treatment doesn't work. Different antidepressants work in different ways, and you may need to try a few different ones before you find the one that works for you. And there are sometimes some people, the medication just doesn't work and you need to try something else. But do not be deterred. Keep trying. You will find something that works, whether it's medication or therapy or exercise. Now, everybody always says, go for a walk, clear your head, it'll make you feel better. This is true because exercise increases the body's production of endorphins, and these are the hormones that improve your mood. Happy hormones. So if you exercise and you release these endorphins, they may help to lift your mood and just alleviate the symptoms of your depression for a little while. But I know it's hard. Sometimes you just don't even want to get out of bed. You don't want to have a shower. You don't want to put your clothes on, and it's just a whole lot of effort. But you will feel better afterwards, and that is the point. I just want to quickly mention that, again, we are not a replacement for professional mental health help and advice. If you are struggling with depression, self-harm, suicidal thoughts, you need to get some help with that, and that's okay. You're allowed to have help. So we're going to have some links down in the description of some places you can go to get help. And that is it for us from today. We're also going to have our references down below. It's just a couple of websites this week, nothing too taxing. If you want to go and have a look yourself, they may also give you some advice on what help that you can get. So I hope you all have a wonderful day. Thank you for watching this video, and we will see you again next week. Bye!